Welcome back, everybody. This is Jeff Vanderbeck, publisher of the News Express, with our ongoing series of news and information from Pike County Health Department. This is our third episode, and in the previous episodes we discussed harm reduction with the Pike County Health Department folks, and last week we did our environmental issues and educational series with what the health department does for the community and how they keep people. We also said that if you see the folks that are out there that were on the podcast eating at a restaurant, you know that it's clean, so go there and eat. I'm joined today by, once again, Ms. Tammy Riley. She's executive director of the health department, and she's got a plethora of other titles too. She'll introduce herself, but I'm really, really excited today because today we're joined by Dr. Jill Keaton. She is the dean of the University of Pikeville's Tanner College of Dental Medicine, and we're here to talk about today a wonderful, very vitally important collaboration between the University of Pikeville's Dental School, Tanner College of Dental School, and the Pike County Health Department. So, Tammy, give us a quick introduction. Tell us about the collaboration. We'll get Dr. Deet to talk about the importance of that with overall health and how it provides a whole new spectrum of health environment to what you guys are doing at the health department.
Thank you, Jeff, and thank you, Dr. Keaton, for being here today. Really appreciate it. Just to talk a little bit about the history and how this collaboration came to be. I've been working on the potential for a dental clinic for approximately 3 years. This is the Pike County Health Department. We have an oral health program. It's a school-based program called Bright Smiles, and that's our dental hygiene program. We have 2 dental hygienists and dental assistants who go out to the school system and provide preventative care for school-aged children. And through that program, we in a very quick amount of time, discovered a great need for more services around oral health for children, particularly for the Medicaid and uninsured children, where the potential for providing services, there's just it's more complicated when you're a Medicaid patient or uninsured to find a home for your oral health needs.
So, and underserved children as well, correct?
They're definitely underserved. So the Bright Smiles program was, going out to the schools, providing these preventative services, and they were finding children who were, having tooth decay. They were having, pain management, trouble focusing and concentration in schools. They were also there's absenteeism associated with oral health issues. And they were coming back and reporting this to me, that they had children that part of the Bright Smiles program is a referral service. So they were, part of their responsibility is to not only provide preventative services like fluoride treatment, sealants, cleanings, assessments, but referral to care. And so during this referral to care process, they realized if the child received, was covered by Medicaid or uninsured, there was more of a struggle. It was just more complicated in finding a home base for that child with the dentist.
Do you mean like a local dentist to take care of that child?
Correct.
Okay.
Correct. I mean, in Kentucky, the population, the ratio of individuals per dentist is high. It's higher than in the state of Kentucky, or higher than in the United States.
Which is another reason why we have the University
Tanner College of Dental Medicine.
Is so vital to not only our community, but it's also vital to the economic infrastructure of Pikeville, Pike County,
right,
but the overall health. So, which it's a very important tentacle, if you will, of the health department's overall scheme. So, and talk about how the collaboration between the university came about and how what started this. I mean, I know
the bottom line is you have fewer dentists per population per person,
right?
Half of is what it's called. And so when you have Medicaid or uninsured, and you have more difficulty in locating a dentist or a home base for that child's oral health needs. And that's when I reached out to the University of Pikeville. The news broke that there would be this College of Dental Medicine. We didn't know it was the Tanner College of Dental Medicine at that time. And I reached out to the university, and explained that there was this gap in service, this great need for our school-based children, particularly the uninsured and the Medicaid patient population. And, we decided very early on that we wanted this collaboration. Some kind of partnership was desperately needed.
And as that happened, Dr. Deaton, tell us a little bit about what happened as far as, how that worked out. How excited was the university to jump into this thing? What the involvement was? How hard was it to convince the university to get involved, other students or anything like that?
Yeah. Well, the University of Pikeville was just thrilled at the opportunity to collaborate with the Pike County Health Department. That's really at the heart of the vision and the mission of the university, which had already addressed the medical needs of Eastern
Sure.
Kentucky and Central Appalachia. And so it was just a wonderful partnership. And I'm a lifelong resident of Eastern Kentucky, and have lived here in Pikeville almost 30 years. And what I've noticed as a dentist is that the number of dentists in the area in Pike County and in Eastern Kentucky has just dwindled over the past 2 decades.
Right.
And we have a fraction of the number of dentists now as we did 30 years ago.
And that is the genesis of the reason why the Tanner College of Dental Medicine is coming to play into the county. Kind of talk to us a little bit about what the vision is for this collaboration. What do you expect to see? How do you expect to promote better dental health? How is that going to work for the university? What's the university's actual role? And let me ask you, is there a dental studio somewhere set up that the university did that is fully outfit, so that when a child from K through 12 gets in there, are they going to go into a dental studio?
Yeah, that's a wonderful question. We've been working with architects. It's actually a team of architects that have helped us design a state-of-the-art dental school. So we'll have a 5-story brand new dental building that will be built on the Pikeville campus
Right.
of UPike,
Right.
adjacent to at the Health Professions Education Building, which houses the Kentucky College of Optometry.
Optometry, right.
The optometry school. We'll have
And the Chick-fil-A's up there too. That's the most important thing. I mean, all this health stuff is great, but let's talk real stuff. Chick-fil-A is up there, and that's most important.
I heard environmentalists eat theirs.
That's right, exactly.
It's wonderful. So, and we'll have 93 dental chairs there. And what I'm thrilled about is for the first time, we'll have every dental specialty that's recognized by the American Dental Association right here in Pike County.
Well,
So some specialists have never been here, and we'll be able to offer every dental procedure that is offered in a general dental office. So fillings, restorations, crown and bridges, dentures, partials. We'll have it's a special care clinic. We'll have a pediatric clinic. We'll have an area that's called the Center for Research and Education and Technology, a CREET Center. So we were named the 2024 recipient of the CREET Award. And we saw this as a wonderful opportunity to work with the Pike County Health Department, because we visualize and envision the CREET Center to be a hub for public health research, which is desperately needed. We need to gather data
sure.
and to make sweeping changes, because Kentucky, and specifically Eastern Kentucky, has some of the highest rates of dental decay, oral cancer, diabetes, and oral health plays a role in overall health.
One of the things that is very important, by getting regular checkups, gum and teeth and all that stuff, there's a lot of other diseases that can be detected through that.
Absolutely.
In addition to having a cavity or getting sealants as a child, you could detect diabetes, you could detect heart disease, you could detect all kinds of different things. Just like when we talked about the optometry school, you look through your myopic nerve and it goes into your brain and finds out. Well, they didn't find one when they did with me, but that's a joke. I mean, you're supposed to laugh here. So see, that's a pretty smile. That's a Bright Smiles program. Well, when you have a good oral visualization of an examination, there's a whole bunch of things they can detect. So I think it's vitally important to getting that. Now, you mentioned something about the kids, and the biggest problem that I think we have in this region is the misconception that, oh crap, I'm going to the dentist. It's going to hurt. Now, you and I have discussed a lot of things, and this dental school that they have is going to be state of the art. And I told you my son works for a dental supplier, Patterson Dental, and they have this program that they're using laser technology. If you will be teaching laser technology there,
Yeah.
so there's going to be no shots, no Novocaine, no nothing. So kids can go in there and go in there and in and out and have their whole mouth examined and get every work done pain-free.
There's so much new technology. It's so exciting to be in the dental field right now with the use of that with AI. We'll have 4 Sim2Care haptics, which are patient simulators.
All right, now listen. Say that again, please. Septa what?
It's called Sim2Care haptics, and it's the same type of technology that's used by airline pilots when they're learning how to fly.
Gotcha.
And you truly have that sensation that you are working in a dental laboratory using a handpiece.
Nice.
And we'll be able to scan the work and to be able to give students feedback in real time saying, this is wonderful, but you could improve in this area.
Right.
And it's a wonderful teaching tool. So we're excited about that. And we're excited about combining wonderful technology that's state of the art along with service, community, giving back. And that's the great connection between us.
Yes.
And so we plan for the students to potentially rotate to the Pike County Health Department to see patients in the wonderful dental space that's been created at our own Pike County Health Department.
So there is a dental oratory or dental place there, simulator, right there.
We have a clinic. We currently have a clinic.
And where's it located?
Well, it's right here in downtown Pikeville,
Okay.
the Pike County Health Department on River Drive. But the Tanner College of Dental Medicine is providing the public health with an actual provider, a dentist, 2 days a month. So the first and third Tuesday of every month, we're providing some of these extended services that Dr. Keaton referenced, beyond preventative care, restorative actual services. And we're doing that 2 days a month. So they could call the health department to schedule that. We're doing that for adolescents who are Medicaid or uninsured. But, even more importantly are these future partnerships that are available so that we can improve public health outcomes for Pike County and Eastern Kentucky. For example, the WIC program, Women, Infant, and Children Supplemental Program, has an oral health component. Our clinic clearly has an oral health component as well as Bright Smiles. Our HANDS program provides oral health education. There's just so many opportunities where the students at the Tanner College of Dental Medicine could be embedded in public health services, and not only in Pike County but throughout Eastern Kentucky.
Is the health department now accepting children now to get oral exams done at this point?
Yes, you can call
Okay.
the health department during working hours, and they will schedule that. It is the Tanner College of Dental Medicine dentist embedded in this clinic, but our staff will take those phone calls and schedule those appointments.
Can we make an appointment online? In other words, can I go online to the health department website and say, this is what I want to do and I'd like to bring a child in there? Or should I just have them call directly
They
to the
will
health
need
department?
to call. That may be
Okay.
something we'll consider in the future.
In the
but
future? Gotcha.
For now, this started like mid-March, so it's very new.
How many students or patients or children have you seen since mid-March?
Well, that's a great question. We've only had a few actual clinic dates, and we've already seen 39 children.
Wow, that's and how do you feel that the 39 children? How do you feel that the lives have changed of those 39 children?
Well, Dr. Held, the dentist who has been providing those services, just has a wonderful rapport with the students. We do use mantras, and if needed, and they've really been, the parents have provided wonderful feedback. And, we see it's a friendly, comfortable atmosphere. So we have, it's the health department. So
Sure.
we have a friendly, warm atmosphere. We're very accustomed to dealing with families and children.
And what would be the capacities? I know school's getting ready. I mean, we're just today we're getting out of school, but but when we turn around, we're going to have back to school. So what's going to be the capacity? When would you recommend parents starting to get their children into the program who need to get an oral checkup and to get the things then that are vitally important to get back to school? And do you offer any emergency services? Let's say we're running around and some kid falls down and busts a tooth on a rock and somewhere.
Right.
What's the
Well,
what's the plan?
the health department, as far as emergency services, we had 24/7 after hours they could call. We would link them to care after hours. We wouldn't have that ability during, what, in the evenings
Sure.
and on the weekends to offer that care. But we're booking now for July. So our 2 June dates are booked.
Good.
So we've already filled those up. And so they would want to call now, call anytime during, the work week. 509-5500 is the phone number. And we would schedule those 2 clinic dates. Now, as the Tanner College of Dental Medicine grows, I'll let Dr. Keaton maybe approach that. But, I'm hoping that we'll be able to expand those days and services as the college grows. And, we're very early in
Sure.
the program.
But at least we started. So is there a plan for expanding?
There is, on our part, we would be thrilled to expand services to have the students, in addition to the wonderful dentist that's there now, have dental students rotate there. And so be able to offer more days, more services. And it's so needed. And we would be able to collaborate with them on other efforts as well. I'm thrilled about the potential of maybe being a part of mobile units, doing those, and as well as telehealth. That's something too that we're expanding. So the dental school and the University of Pikeville are looking for opportunities to serve the community, as well as provide quality education to students. And our mission is to educate individuals that are interested in serving in rural and underserved areas. So, our desire is to identify those students that are academically gifted and have a heart for service and want to serve in rural and underserved areas.
You made a great point there, Dr. Keaton, for public health. And from a public health perspective, what I'm trying to do is bridge a gap. And the Tanner College, and so the clinic at the health department is just one small component of bridging that gap. The Tanner College of Dental Medicine is really the long-term solution. So as they produce dentists, and you referenced the studio that you will have on site. So that studio will provide services.
Sure.
I'm sure that, and I know I've heard about many other partnerships that the Tanner College of Dental Medicine either already has in place or they're working on. So all of those activities, looking over a 5-year and a 10-year period, will bridge the gap that we currently have for oral health needs in Pike County.
Right, exactly. I just want to kind of preface on one thing. I did mention something about emergencies. Always, always, always 911 first. So if there is ever emergency, whether it's oral or if you fall down, go boom, or whatever happens, always 911, and then get on with the health department that particular time. Real quickly, what's the cost involved if for the exams and stuff at the health?
That's a great question. So all of the patients, all 39 of the patients that we've seen so far were Medicaid. That's where the great need is. Close to right around 70% of our children, Jeff, in Pike County rely on Medicaid for their health insurance.
Sure.
So we've only seen Medicaid, and we do bill the Medicaid. And if you're uninsured, there's a sliding scale fee, and it's very minimal.
So it's
Structure.
very affordable, but it's vitally important that people go out and do that. So, again, we want you really, really to invest in your oral health. It's vitally important to do that. The University of Pikeville, with the Tanner College of Dental Medicine, is really going to be doing fantastic things. Again, thank you, Tammy, for all the efforts that the Pike County Health Department is doing. I mean, it's so amazing to see the fantastic things that you guys are doing, the fantastic partnership with the University of Pikeville. And when things like this come together, it really shows how powerful a small community can be to make great strides in things. So I thank you both for doing that. I thank you both for being here, and I thank you all for watching and listening. Dr. Deaton, once again, thank you so much for your time. Tammy, always nice to see you. And since this is the Bright Smiles program, we have to end by bright smiles. So smile.